what Ebola is and where it's from. The Ebola virus has been around for decades. It's an old virus, very old virus, unlike AIDS, which is a new virus. Ebola is old, and it was found in the Ugandan green monkey. There was fever, hemorrhage, that sort of thing, and the kidney tissues of that monkey were being studied in northern Germany in a lab. And the virus was passed from those tissues to nursing and physician staff, and 20% died. And it was sort of the first epiphany. They opened the genome of the virus and found that it was very old. And further experiments were done in 1990 in Reston, Virginia. But again, it was deemed to be not a human virus, but only an animal virus, and it showed up in pigs in Asia. They identified the virus in fruit bats in the spleen and liver, but didn't know about transmission and weren't sure basically how it was transmitted. But they know that the fruit bats are a carrier, and they remain healthy despite having the disease in their lung lining. So it's very interesting that similarly, there are humans who actually have the Ebola virus, but don't
so like
get sick.
Like chicken pox, and you have the virus forever, but you don't.
That's
that's
more like there's a lot of science that is going on to determine. They think it's related to what kind of immune system you have. However, if your immune system has a very big response, that also can be deadly.
Yeah.
So there's much that's not known about why certain people survive and why others don't.
Seems like AIDS is that way you can test HIV positive, but not actually have full-on AIDS.
Yeah.
So that's, I would equate it more to that than the chickenpox, which is more like you then create the antibodies for the chickenpox and then you can't get it.
Yeah.
The thing that's interesting is the fruit bats drop partially eaten fruits consumed by other animals who then become infected and die, and humans in many parts of the world actually eat monkey
Animals?
And it's in the killing of the monkey and in the blood that humans themselves can get infected. It's not from eating the meat that's been cooked. It's from actually doing the work of killing the monkey to be able to cook it and eat it.
That's been one of the most intriguing parts that for me, is listening to it. It's like normally when someone dies of a disease, this seems to be deadly infectious after death.
Yes, well,
and that's one of the very difficult pieces of this, especially in Africa with their ceremonies, right? And their culture.
Exactly. 70% of the infection thus far is really related to the washing the body of the dead person. And because that is often done in a central place where people bathe and people...
So then people oh wow.
So then people have, the transmission has really come from that.
That's how it's so fast?
70%. Wow. So that's why the infection rate you need to get ahead of the education.
Yeah.
And that's really hard to do. And then the infectious rate of the disease increases over time. So unlike, you might get the flu, and maybe the day before you have your temperature, you were with a bunch of friends and you want to tell them, oh, I got the flu because the day before I saw you. Ebola is exactly the opposite. You cannot transmit Ebola to anyone until you have been infectious, and likely infectious for at least about 3 days. You would have had to have had a fever for a long time before you would have enough infection in your body to transmit somebody to someone else. And there's so much misunderstanding about this virus and about how you can get it.
So
even in those patients that were treated in Emory University, after they left and they were healthy, they went back into the rooms and tried to find traces of the virus, and they couldn't. the virus only lives on a doorknob or something like that for a few hours. So
Really?
by the time the person left, that virus was gone. So people are worried about airplanes, they're worried about all sorts of things that they actually needn't worry about. As the infectious disease specialists from the Center for Disease Control have said, someone riding a subway it would be almost impossible for them to transmit the virus unless they had been infectious for a long time, they suddenly vomited or suddenly
coughed,
sneezed and had, fluids that came on to someone who had an open wound or
there's a lot of if.
Yeah, it would be difficult. So there's a lot of panic in this country right now, but honestly the focus needs to be on these 3 countries where the infection is really rapidly increasing and where we can get ahead of it if we intervene now with people that are talented and who are experts in infection control, who can protect themselves and the Ebola patients and give people the treatment they need to enable their bodies to recover. It's very important.
So you would know that you had the virus. So you wouldn't be able to spread the virus basically because you would know you had it, or you wouldn't.
Or you would know
you
were
had a flu or
educated in
something.
if you were
country.
educated
Yeah.
or there, if you were educated, if you had learned, I have a fever, which is why they're testing everybody in these countries for fever. I have a fever, I will quarantine myself or be quarantined by being taken to a health center, and these health centers are tents. I mean, it's really all it is. It's a tent where you will stay and be removed from other people. And then, unfortunately, the way the virus works, it really just sucks the fluids out of you through diarrhea and vomiting, and it's very much like cholera that way. If you get to a cholera treatment center, you will live.
Yeah.
If you don't, you will die. Cholera is that black and white. It's very clear. You need to have fluids, and your body needs to heal. Ebola, it's less clear who will live and who will die, but you need the treatment.
But you'll definitely die if you don't get the treatment.
Exactly. Let me just tell you a little bit about the numbers. So the patient becomes sicker and they become more contagious.